All right, good evening. Welcome to Feet Forward with podiatrists from the Illinois Podiatric Medical Association. My name is Chris Martin. I'm your host. And with me tonight is Dr. Marlene Reed, who is a podiatrist from Westmont, soon to be Naperville, I should say, if we can get the painting all worked out there. We have discussed heel pain on previous episodes of Feet Forward. And speaking of previous episodes, I'm very excited to say that people can now see previous episodes of Feet Forward on YouTube. So if you just go to www.youtube.com and type in IPMA, all the previous episodes will come up, including this one in a couple days. So if you want to go back and review our greatest hits, feel free to. Tonight we're going to talk about advanced treatment for heel pain. And Dr. Reed, heel pain is very common for a lot of people in society today. People who are active and people who are not active too can get heel pain. So it really cuts across all barriers. So let's talk a little bit about the general sort of characteristics of heel pain. What causes it? What are the general treatments? And then we want to talk a little bit more about some of the specific treatments for really treatment-resistant chronic pain.
Sure. Well, it's interesting because in my practice, approximately 40% of the patients I see come in with some type of heel pain. Most of the pain in the heel, in the bottom of the heel, is due to a condition called plantar fasciitis. And if you look at the foot, you have the architecture of the normal arch. And there's a tissue, a banded tissue that attaches from the heel and extends all the way to the ball of the foot. And so many causes can cause pulling and tearing even, and stress and inflammation of the attachment where that fascia attaches to the heel. A typical scenario for heel pain of plantar fasciitis would be morning pain. First few steps in the morning. After you've been sitting resting, if you're watching TV in the evening or sitting to dinner, and then you get up and you stand, pain for those first few steps. And that pain lasts. It depends on the extent of the heel pain, but that pain usually just lasts for the first few steps, and then it gets better.
Why is that? I mean, it would seem like if you're more active, the pain would be worse. But in this case, you've been resting all night, and the first step, you wake up, you trip over your slippers because you're experiencing so much pain. Why is that?
Yeah, I'm laughing because people don't understand why that is. And inflammation is a physical thing. It's actually a buildup of fluid. And as you rest or sleep, the fluid accumulates in that spot. And as soon as you step, the fluid moves out and disperses. So as the fluid moves away, the pain moves away because fluid is a painful condition. There's pain sensors in the fluid. So heel pain, when it first starts, is mostly morning pain. And then it progresses as time goes on, and it can become painful all day long.
Let's take a quick break. We have our first caller right off the bat. Go ahead, you're on Feet Forward.
How you doing? I have pain in my penis.
Let's keep moving on here.
So heel pain can not just be caused from plantar fasciitis. There are other causes, and when a patient comes in, the first thing we need to do is to rule out some of the other causes, such as a stress fracture or a actual rupture of the fascia. It can actually rupture from an injury. So the first step we have is to make sure we have a proper diagnosis, and that becomes especially important when someone has had heel pain long term.
Do you need an X-ray to rule out a stress fracture?
Yeah, an X-ray is helpful in ruling out any bony abnormality. And I think we must have talked about heel spurs on the previous show with heel pain. Heel spurs are more a result of the fascia pulling at the site. And the heel spur is generally located right at the attachment of the fascia. And it's more of a pulling problem. We don't treat heel spurs per se anymore. In the past, the surgical treatment for heel pain was cutting open and releasing the fascia and removing the spur. Most podiatrists now don't believe that the spur is causing the pain, so surgery has actually changed.
I see. So once you get a clear diagnosis, typically, and this is for a new patient, not a chronic, what are the recommendations or treatments that you offer from a conservative basis first?
I tell my patients that I treat heel pain as if it's a pyramid, and the bottom level are simple things such as proper stretching, proper shoe control. A shoe should be worn all the time, and it should be the right shoe. A shoe that has a firmness behind the heel, cupping the heel, and it can be an athletic shoe, it can be a dress shoe, as long as that's firm, and that gives the heel support. There are also other different types of heel support devices. In fact, I use a heel cup that goes in the shoe, but the key is stability. So I have people stretch. They do Achilles tendon stretches, and they do stretches of the fascia. And most people, within the first 2 weeks, I would say probably 60% of the people within the first 2 weeks are almost all resolved if they do those things. That's the first level of treatment.
We're going to try another caller here. Let's see if this one's more civil. Go ahead.
Yes, indeed, you do. I want to talk about sensible shoes. My daughter's sitting in front of the TV. I'm talking about shoes that women wear in the wintertime. Instead of wearing practical shoes, go for practicality instead of going for fashion. Can you comment on that? Because some of the shoes women wear during the wintertime is really not suitable in terms of keeping your feet warm and dry.
Yeah, you know, it's funny because for years I wore shoes that I would recommend, and at some point women podiatrists especially decide, hey, wait a minute, I want to wear shoes too. And it's important to remember there's a balance between health and a balance between what's comfortable, and also we have to admit fashion's important too. But you want to have a shoe, yes, that is right for the time of the year. You want to have a shoe that provides traction in the winter. You want to make sure you're not slipping, and it depends what your exposure is. If you're downtown and you're walking to work and it's a snowy day, yes, you don't want to be wearing open-toe shoes. That's important as well.
Great. Thanks for your call. We've got another caller.
Hi. The previous question I think is a good segue into my question. I have pain on my left foot. It's really my ankle, my ankle bone. It's right below my ankle, but everyone has. I think it's my ankle bone. But I wear a lot of heels, and when I walk, sometimes there's like pain that shoots in that area. And I do see that it's inflamed more than the other ankle, and I don't feel it at all in the other foot. And you were talking about fluid, so I was wondering maybe. And I do wear high heels and walk downtown and get off the train and walk to work. So.
Let me ask you a question. Do your arches sort of fall when you step on them? Do you lose some of your arch when you step?
Yes.
Okay.
Yes.
You are probably experiencing a problem with the tendon that holds up the arch. The posterior tibialis tendon. And it's funny because that is one of the common misdiagnoses for heel pain.
Oh. Okay.
Very often people will be diagnosed with plantar fasciitis, and actually it is inflammation and deterioration of that tendon. And that's a very difficult thing to get rid of and to solve once it progresses to a chronic problem.
Okay, so should I go, and can I go on www.ipma.net to be referred to a podiatrist to actually start, the process of being diagnosed? And
absolutely, and that is a fairly common diagnosis, and there are standard treatments for it as well.
Okay, thank you.
You're welcome.
Do you have another caller? Wow, they're really rolling in.
Hi.
Hi, how are you?
I'm
Welcome
okay.
to Feed Forward.
I've been treated for plantar fasciitis on 2 different occasions. I had the injections in my feet, and it seems that it will take the pain away for a while. Then a couple weeks or months later, I start getting those same symptoms that you talk about, where I stand up, my feet are throbbing, and it's just getting worse. And I like, I'm a person who likes to exercise. I can't dare even jog. Then my feet really start hurting. So is there any type of cure for this, or do I have to totally stop exercising?
Let me ask you a question. When you've had the injection, how long